family and personal history. Second is I will add professionalism to it.
Additional.
It's just 2 points, which you will not say I am doing professionalism. That your instructor observe in you. When I write down here professionalism, can you say I am doing professionalism or I am doing professional attributes? No. Instructor observes you when you perform that. Are you dealing with your patient very professionally? Yes, please.
That is a little paper which we given to us.
Yes. I will do it.
What?
Can I email it to you by your official email?
Which is?
Your Blackboard email.
No.
On Facebook.
Facebook.
Okay.
I'll do both. I'll put everything on.
هذه.
Now, let's start.
After addition.
Let's start practicing. The better idea should be one of you could do it, and I will.
Okay, evaluate.
Evaluate, or I will just be with him. So who wanna do it? Who wanna volunteer? One will be patient, another will be an assessor. You're what, patient or patient? So who is the person? It's complete. We'll give you a scenario. You go to station 1, and then another person will go to station 2. Or you want me to demonstrate once? Okay. So for that, sit in this way.
هو بيسوي يعني professional.
So let's assume this way. We have a patient who is 50-year-old male. He's complaining of chest pain. And he's sitting on a chair holding his chest. He says he has uneasiness in his chest and epigastric region. And he called ambulance, or he came into emergency department, whatever it is. Let's say ambulance now to have a full coverage. So we are approaching his house, and this is our patient. So we start with, when we start our ambulance, we start with scene size up, isn't it?
Yes.
The components are, I will put my gloves on. I'll think about how many patients. I have only one. His nature of illness is chest pain. I don't need any additional help. As I approach my scene, I will look for the safety of the scene. Safety of the scene. So this concludes my scene size up or preparation. Then I am approaching to the patient. As I enter to the room, I see a patient here. Just explain, his general impression is, I see a 50-year-old male. In real case this, I see a 22-year-old male. Is sitting on the chair, holding his chest, and he looks like sick. He looks like sick. So, any patient like this, he is looking like sick, isn't it? So this is my general impression. Then I go to him. Assalamu alaikum. How are you doing? This is me, Dr.salaam. I'm here to help you. So could you please tell me, what did you call ambulance? Have chest pain? Okay. Don't worry, we will take care of you, and you are in good hands. So what I got? Why did you call ambulance? What I got now? I finished. Chief complaint. So, but before that, I talked to him. Salaam alaikum, and I've given him my hand. During this time, what did I do? No, hey, what did I do? I finished my initial assessment in between. Did you notice that? It was very quick. How come? I just came to him, I smiled at him, Assalamu alaikum. So, I asked him one question. So, in full, I covered my initial assessment. How? His level of consciousness is alert. His airway is
Open.
He is breathing fine. His circulation, by looking to the compression, is fine. Now, next step I will do is I will check his approximate pulse. Approximate pulse. So, this is done. ABC is done. Now it's my prioritization. Is this patient I will consider as a serious patient or non-serious patient? As he is having chest pain, I will consider him as a serious patient. So probably what I will do is, I will try to either take him to ambulance and complete the remaining history. That could save my time. So I will simply take him to ambulance to complete my remaining history. Just explain him, you are in good hands, we will take care of you. Let's move to hospital. Then on the way you could complete the remaining histories, isn't it? So now we finished initial assessment, which was quicker. Just say him Salaam Alaikum and look at his response. So this finishes, and also we know his chief complaint. What is the next step? To know the history of present illness. What is that? OPQRST history. So to know OPQRST,
take him to the
yeah,
ambulance?
yeah. You could or you may not, but I would prefer to save time, take him to ambulance and you could ask remaining histories, isn't it? So take him to ambulance and check with him. Now I need to ask OPQRST history. So how we do ask that? So, could you please tell me how did this chest pain start, or what were you doing when this pain started?
The onset.
Sleep. Then wake up and wake up.
Okay, this is something. Okay, so you were sleeping, and when you wake up, you had. So it was a sudden chest pain, sudden start of chest pain. So could you please tell me what makes you better or worse with this chest pain?
When I sit like this,
Okay.
I feel good.
Okay, when you sit like this position, you feel. So if you walk, you have problem. Okay. So be comfortable in your position. Could you describe your pain or difficulty?
It's sharp. It's like
Somebody is cutting your
Yeah.
chest out. So is it only here, or is it moving to somewhere else as well?
it's not only.
It's only the middle of the chest. Okay. So if I say in a scale of 1 to 10, so how severe it is? What time it started? Around how many minutes or hours? Half an hour. So we finished O, P, Q, R, S, T. See, it's very difficult for you as a beginner to go through OPQRST, because after you ask one question, you will forget another question, what to ask. So what you could simply do is repeat OPQRST O, OPQRST P, OPQRST Q, OPQRST. So repeat OPQRST, and you will see what you finished. And what I was doing is I was repeating in my mind, but still I was confused. Am I missing something or not? So repeat OPQRST O, OPQRST P, OPQRST Q, OPQRST radiation, OPQRST severity, OPQRST time, this way, and ask the questions again. How did this pain start, or what were you doing when the pain started? Provocation, what makes you better or worse? Quality, describe your pain. How do you feel, or what do you feel? Radiation, where is it? Location is here. From here, is there any movement? Is there any other parts affected with this, or is it radiating to somebody else? If you ask your patient radiation, he will not explain you. So just ask him, are you feeling pain here or somewhere else as well? So he could explain you better. Then severity, on a scale of 1 to 10, how severe it is, what time it started. So I finished OPQRST. Now I will go to sample history.